We are back now to COVID-19, managing it as we go through the trying times of this particular pandemic. Now, Alice Koinange, a Kenyan who lives in Texas, USA, is a former U.S. Air officer. She is in self-isolation at home after being diagnosed with coronavirus. Tonight, the recovering COVID-19 patient shares her story. Alice, how are you today? How are you feeling?
Thank you for having me. I am coping with all these symptoms and mainly fatigue and shortness of breath. So it's not easy. And just letting people know that this disease is real and they need to listen to their body, because that's what I did not do in the beginning.
So Alice, you're able to speak to us, and you're saying earlier, I heard you say that you're short of breath sometimes. Let's begin with when did you exhibit symptoms, and what did you do when you started feeling a certain way?
So I would say 2.5 weeks ago, I had headaches. I also had sore throat and coughing. But I made excuses. I didn't listen to my body. I said this could be allergy season, and that's why I'm having this sore throat and running nose. Then I started having body aches. I made an excuse, said that I've been working out. This is just strenuous exercises. And day after day, I kept having more symptoms, but I didn't think it was COVID-19. I just thought it was just seasonal allergies, and I also have asthma. So when I started having shortness of breath, I thought, you know what, I need to use my inhaler. So I didn't listen to my body. This was 2.5 weeks ago. So if I had done that, if I had just listened to my body, we would be in a better place, meaning that I'd be in the recovery period farther than I am right now.
Mm-hmm. So you said, you've listed to us the symptoms that you are experiencing. And at what point then did you confirm that indeed it was COVID-19?
So last week on Tuesday, I was really, really short of breath. And I was also having nausea and vomiting and loss of taste. I could eat food and I couldn't taste anything. So I decided to go to the ER at the VA hospital because I'm a veteran and I couldn't really breathe. And the doctors checked me out and they said I have all these symptoms. So they decided to do a nasal swab, and they told me to wait for 3 days. They sent the swab to the lab in a hospital here in Dallas. So they called me Friday morning. I actually got a call from the health department. I was very, very shocked because I thought they'll call me and tell me it's negative because of all these excuses I was making. And they told me that I need to be in home quarantine. So that's what I've been doing right now. But on Saturday morning, I was really short of breath. And I went to one of the local hospitals near my house. And they put me in this negative pressure room and had, just like what we watched in Kenya, had all these health professionals come up, gowned up in PPE that's protecting them. And while we got there, they were already ready for me because we had to call the hospital. You just don't walk in, or if you go there without having called, you have to tell them that you have COVID-19 so that they can prepare you and take you to a negative pressure room. So that's been my journey. So many other things. You can have diarrhea. I also had that. And body aches. I'm telling you, fatigue. My body is aching everywhere. My fingers, my toes, places I didn't really think I would have pain. So I want people to just listen to their bodies and look out for those symptoms, because not all of them have been told to us. They're also, the CDC and all these doctors, this is new to them. They're also doing surveillance. So if you feel something is off, there's a reason why you're feeling it.
Mm-hmm. So, Alice, you're at home, I presume, right? So
Yes.
How are you coping with this condition, and how has this quarantine situation affected your life?
So right now I'm in a separate room in my house. There are 2 rooms. I'm in my bedroom. So my husband moved out to the guest room. So I'm all by myself. And then I have a guest room where it's like our TV room where we sit down and watch movies. And I have 4 kids and my husband. So my house is busy. So my family is downstairs, and when I'm interacting with them, I'm using this N95 so to avoid the droplet. And I also have gloves, and when I'm walking up and down, and my husband and kids are FaceTiming me in the house to tell me, Mom, we have food outside your door, because they can't come upstairs. And that's how we are communicating. It's difficult because I can't touch them. And it's just communicating through the phone until the health department clears me. And also the military medical unit is also checking on me. So they also have to clear me to go back to work.
So interesting, Alice, that your family is living within the same environment, within the same house. You say you're in a separate room, though.
Right.
So how are you ensuring that the rest of the family does not get infected, that there is no contamination whatsoever? What measures is the rest of the family putting in place to ensure that there is no infection?
So all my family members have face masks, like you saw those some of the health professionals have, and also the people in the street, just the regular face masks. And everyone's wearing gloves in the house. And my husband's cleaning everywhere. I have only two places I need to go, the game room and the bedroom. That's it. I'm not going downstairs. I'm not touching anything else. And they have a bucket where they're putting all my bowls and everything I'm using, although I'm preferring to use disposal, cutlery, plates, cups, but we still use my regular cups for tea. So I have a specific bucket that they're using to wash the dishes. They're not using it with everybody else. I'm not sharing with them. So that's what we're doing. And then we have a trash can, and everything that I have is being disposed separately. And all my clothes are in a bag. Right. We are not washing the clothes at home, right?
You've been vlogging, Alice, and I watched one of your vlogs, and thank you so much for sharing your story. But in terms of how you rate the American government's handling of this pandemic, given that the strain on the medical facilities there has been reported, and yet we don't have such facilities here as yet. How do you rate how the American government is handling the pandemic there, and the threat, therefore, that you would think or you would presume COVID-19 poses to us, given that we do not have such facilities here?
I think the American government is doing a good job. There's testing going around. We have every system in place with the CDC giving us all the information we need to have. The health professionals are getting the PPE to safeguard their safety. And there's information with the health department letting people know about the quarantine and what they need to do. So they're doing a good job. Right now, the U.S. population is really high. So with the numbers that we have, the CDC and public health is doing the best they can, because this is a new thing. It's a pandemic. There were shortages, as you heard, in every country, everywhere. So we are managing, and everything is going well. People are being tested, and the government is doing the best that they can. I think we'll see a change in the numbers.
Mm-hmm. Last question, very briefly, Alice, you chose to vlog, you chose to document your journey. It's on YouTube. Why the decision to do so while in isolation?
I thought that coming out would be a good thing, because I'm in the health profession. I'm a registered nurse. And I felt that a lot of people are hearing things that are not true. So I wanted to demystify this coronavirus, this COVID-19, let people know that it's real, and for how they can take care of themselves, the social distancing, the hand washing, and just let people know that this thing is here. And if we don't take care of each other, it's going to continue lingering and spreading. So we all have a responsibility to help reduce the numbers and to stop it from spreading.
Mm-hmm. Our viewers are forwarding questions to you, and maybe just in the interest of time, let me forward one to you. What medication are you on? Are you currently under treatment? And if so, what medication are you currently taking?
COVID-19, the coronavirus, is a virus, so there's no medication. This is something you just have to write it out. Other than the fevers that they tell you, take a fever reducer and a painkiller for the muscle aches, there's really nothing you can do. You just rest and just write it out and just isolate. It's all about timing. There's no medication or vaccine that we have right now that we are being given. It's just isolation and resting.
And
Right.
finally, somebody here saying, if you are infected or if you find that you are positive with COVID-19, for you, a message of hope for persons perhaps in isolation centers that are feeling discouraged and are not used to this quarantine environment, being by yourself
Right.
for all these days. What is keeping you hanging on? How are you hanging in there? What keeps you going?
I have hope, and I feel that I'm not alone because people are sharing their stories. There's been stigma, but I think more people, when they're coming out, it's a sense of hope and resilience. I want to encourage everyone who is alone in this confinement to know that they're not alone. There's social media now. That's how we are all communicating. Yes, we are missing the human factor of touching, but this too will pass. It's just for a couple of weeks, and then hopefully we'll get back to our regular life. For me, I miss walking outside, having fresh air, but I hold on to my faith, and I just trust God that this will be fine, that the situation I'm in is not going to get worse. It's going to get better. And I want to encourage everyone that that is my hope for everyone. Just hold on to faith. You know, sometimes the way you think goes a long way with how your body reacts. You have to have the will to fight. So there's hope.
Yes, and I love that you're saying that with a smile, Alice. What strength. We thank you so much for speaking to us here in Nairobi. She's speaking to us from Texas in the United States. We thank you so much for your time. Alice has resorted to vlogging. She's in isolation. She's confined in that room, but she's chosen to take this positively, take it head on, and indeed just try and occupy herself with things to do, such as vlogging. I know some people might be too unwell to do that, but for her, that's what she's chosen to do. Now, in total, there are at least 700,000 COVID-19 cases in the United States of America and a total of 30,000 deaths. In Texas, where Alice lives and where she's just spoken to us from, there are 17,000 COVID-19 cases and 428 deaths so far. And we certainly hope that she will beat this, and we will check up on her in the next couple of days.